Are you recording? I like you would say trust, confidence. Imagine the possibility of having readily available treatment for people that are affected by COVID. Imagine having all kinds of actions we could take with confidence to keep ourselves safe during this time. And imagine having the trust and confidence to get back to work. My name is Raj Doraisamy, and I'm a technologist. I have a company that creates software for mobile apps and websites. And the reason I'm doing this video here for you is because we have been taking all of the precautions. This is my second mask. I got a box of these gloves in my car when I'm filling gas. I've got hand sanitizer in my car, in my house, in my backpack, and one back up in my backpack. And I think all these things are really, really important. We're doing that, or I'm doing that, particularly because my mom, my 81-year-old mom, lives with us, so it's a very big concern for me. But the reason I'm doing this video is because I have been troubled by the censorship on treatments for COVID-19. Look, I came from Africa. I was not born here. I'm grateful to be in this country. I came here because here in this country we have freedoms that we don't have where I grew up. Those personal freedoms are so critical and so important. With free expression, freedom of speech, free expression, you have the opportunity to say the things you want to say without being afraid of being censored. You have the opportunity, therefore, to take actions, and with those actions, you have the opportunity to innovate and invent stuff. And the quality of life we have here is because we have those personal freedoms. Look, we wouldn't have the iPhone or Android you might be watching this on. We wouldn't have Netflix. We wouldn't have Google. We wouldn't have Ben & Jerry's ice cream if it weren't for innovation that ultimately is based on free expression. And when I saw this censorship that at such a wide level, I got concerned. And I want to share with you what I found out, because although I'm a technologist, before that I was trained as an accountant. I got my CPA license. I'm not a doctor, but as a CPA, we are trained on how to evaluate financial reports. So when we're brought in as an auditor to a company, we're entrusted with determining if those financial reports are misstated, are they accurate, can they be relied on by the general public. And the way we do that as a CPA, among other things, is we match and tie those reports back to source documents. An example of a source document is the bank statement that comes from the bank, the receipts that come from other vendors, canceled checks, signed documents that have signatures on them. That's how we validate financial reports. What I'm about to show you is a source document from the FDA site itself. And when I saw this source document on the FDA site, I was shocked. The reason I was shocked is it suggested, I'm wanting to hear your opinion on this, but this document suggested that the reason that these treatments are being censored is not because of the merits of these treatments or not because they did a double-blind study or not. We have all kinds of medication that we use today that are approved by the FDA without double-blind studies. So it's not that. Could it in fact be that the reason these treatments are being censored is because of old-fashioned financial greed? You be the judge. Let me show you the document and let me know what you think. Let's take a look. All right, we're going to look at the United States Food and Drug Administration, aka FDA. This is a source document. This is right at the source. You can look up here at the top. It's fda.gov, not something from the media, social media, news, government. It's right from the fda.gov. Now, quick note on this video. You can hear some background music here. I'm recording this on loom.com. Why am I recording it on Loom? Because with Loom, the video is not recorded on my computer. It's recorded straight onto Loom servers. It's stored on Loom servers. And there's a version of this video that I'm doing right now in front of my computer on Loom. Why am I doing that? So that I can have a document, a video, where if you wanted to do some forensic analysis and see, was this video edited, was this manipulated, you can go right to Loom and you can see the video on their servers, and you can do forensic analysis there to see that this video in fact is not been altered or edited. I downloaded a copy of it and I put the music soundtrack here, but if you want to see the original, you can go to Loom and check it out. Having said all of that, talking about source documents, here we go. This is a letter written on May 1st, 2020. It's written from the FDA to Ashley Rhodes, Senior Associate from Gilead Sciences, who wrote this letter. This letter was written, signed, digitally signed here, you can see, by Denise Hampton at the FDA. Why am I showing you this letter? The reason I'm showing you this letter is this is a letter that authorized Gilead to move forward with the necessary funding and fast track for the work that they're doing. They're doing good work. It's good what they're doing. That's not a problem. It's not an issue. Should they make a vaccine? Absolutely. This problem is so big, we need to pursue all options on all channels. But here's the thing that I want to point out. In trying to figure out why the government, the news, why a lot of organizations were so were so specific in censoring the conversation about treatments on this topic. Why are they doing that? Well, according to this letter, this is a document here, there are 3 reasons. Look, there's a lot of money passing hands here. Remember the war, Desert Storm, the Iraqi freedom? I mean, these are big initiatives, billions of dollars moving from hand to hand. Not a bad thing, but recognize that they're just billions of dollars moving from one place to the other. Here, there are 3 criteria given by the government to authorize 2 things. 1, funding. 2nd thing, fast tracking this work. They're eliminating steps, red tape, due process, consideration, all that's being eliminated to a large extent so that they can get this work done fast because we have an emergency with COVID. 3 reasons that they use to justify such an action. You can see reason 1 here, reason 2 here. The 3rd reason is, I'll read it, there is no adequate, approved, or available alternative to the emergency use of remdesivir for the treatment of COVID-19. I can't even pronounce these drugs names. But there you have it. In other words, the way I'm reading it, now if you're an economist or analyst or government guru or someone with expertise here, a medical person, please let me know where I'm missing it here. But to my CPA mind, what I think I'm seeing is we are authorizing you, we're going to give you the funds, we're going to fast track it, we're going to remove all the due process that normally delays things, and we're using 3 reasons to justify this action. Reason 1, reason 2, and number 3 is there isn't a alternative. Now look, if the guys that we're trusting to lead us in this conversation, that we're paying their salaries to figure this out and lead us, because we have to do we have to live our lives, we're trusting these leaders to make the right call for us. If they would just say to us, look guys, you need to fast track this, it's not cheap, there's factories that need to build, people need to get paid, and the only way we can fast track this is if we eliminate any possibility of alternative treatments. At least that would be authentic. At least that would be straightforward, and most importantly, it would be transparent. Instead, there's what there is. If you've been watching the news, well, if you haven't been watching the news, any conversation about other treatments are being censored. So there you have it. You tell me what you think is the case, but to my listening, this is a financial conflict of interest. We're going to, in the interest of moving money through this government vehicle, we have to keep the conversation about alternatives to remdesivir off the table. We got to do it, or else we can't spend the money. That's what it looks like to me. And if that's the case, everything that these guys are saying is now no longer as reliable as it needs to be, because there's another alternative hidden motive. That's key. It's hidden motive. just be transparent. Just tell us what it is, and trust us to listen to you and do the right thing. But if you start obfuscating data at the top level, it just becomes worse. If you want, I'm going to share a couple other things beyond the topic of this piece here, and I'll go into right now. But that's at the end of the conversation that I wanted to share with you. I'm going to share a couple of things. The other things I want to cover is so much conversation about I can't even say the word HQC. That's the abbreviation of hydroxychloroquine. So much conversation that it's unsafe, it's dangerous. So I want to show you something. Remember, I came from Africa. We have malaria in Africa, and hydroxychloroquine is used for treatment. And this document I'm showing to you is the CDC website. I'm actually looking at the cdc.gov site. You can see it right there. And on CDC's website, if you go to this link, do a search for this term, you'll find on this particular listing, and a bunch of them, there are 7 references to hydroxychloroquine, HQC. You can look at this at your leisure. I want to go to the ones that are really interesting to me. Actually, let me go back up there. Look at this. Hydroxychloroquine, as of right now, August 6, 2020, still okay to be used by pregnant women, breastfeeding women. Doesn't that mean it's safe? Right? I mean, if it was bad for your heart and killing people, the CDC wouldn't have it on their website, would they? I mean, I know government's inefficient, but I don't think they're that inefficient. So anyway, tell me what you think. Am I missing something here? So anyway, we've got that. Then let's keep going. Oh my gosh. Reasons to consider using this drug. So they're even giving you reasons to use the drug. Then they say, here's how much you should administer, the dosage right here. And what happened is some doctors, I don't know why, but so you can see right here, 300 milligrams, right, of this chloroquine. I'm assuming chloroquine and hydroxychloroquine are similar. I don't know that. If you know, let me know. But they issued 2,400 milligrams. And people died. Well, if I take enough aspirin, I'll die too. So we got to follow the dosage, but that's a dosage right there once a week. So I guess if you give 2,400 milligrams, bad things will happen. So it's not because the drug's bad, according to this. They're recommending use it. But here's the kicker. I want to show you this other piece here. Look at this. I think I missed it. Let me go back. Here it is. They even have a pediatric dose. Now, if I understand correctly, pediatric dose means the dosage you can give to kids. Is that correct? If that's correct, they're listing it right here. So, what's the deal, right? I mean, tell me what I'm missing here. Okay. Another thing is, there were these studies, and these studies found that these drugs are bad for you. Well, okay, I got it. I'm concerned. If there's a study that shows the drug is bad, please tell me. My goodness, I don't want to hurt myself. So here it is. Look at this. That study was retracted. I don't know how often that happens, but I don't think it happens very often where a scientific organization would issue a study and then retract the study. But apparently that happened here. And you can see the article here. You can see it's right here. If you go to the bottom, the Lancet, that's where this is coming from. You can see the date. The Lancet, as I understand it, is like the Rolls-Royce of medical journals. You've got a bunch of medical journals. The problem with medical journals is they need money, so they get sponsored, and they get sponsored by pharmaceutical companies. Again, not a bad thing, but when that happens, there's a concern about whether or not those studies are now objective, or if those studies are favoring the companies, the pharmaceutical companies that may be giving them a ton of money. The Lancet, from what I understand, you tell me if I'm different, is the most objective. They do a lot of hard work to keep themselves insulated from special interest groups and so on and so forth. So there you have it. This is the Lancet. They retracted the study. And it's from their site. You saw the link down there. Let me zoom in just in case you can't read it here. I'm just going to zoom in here so you can see it a little better. There. Okay, so you can go look at it for yourself. Let me go to the bottom so you can see that. There. And here it is. Here is the retraction. Retracted. Look at that. Interestingly enough, when I looked into why it was retracted, there was a group. You read it for yourself, okay? I mean, the point is you need to get your own facts here. But the group that initially said this drug is harmful based their information on some data, and then the Lancet organization, their process is you need to now go back and verify your original findings. You got to go back to source documents like I'm doing here. So when they went back to look at the source documents, that was refused. Woo. The source documentation that was the basis for the report that said this drug's harmful, they weren't allowed to look at the source documentation, which is highly unusual because this is all, it's not political, it's science, but that apparently is a backstory there. So there you have it. Please do let me know your thoughts on this, and would love, particularly if you have expertise in this area, please do chime in. Very, very interested to hear what you have to say. And at the end of the day, if we can have a greater level of transparency and authenticity, we're likely to be able to get to a workable situation faster and have that workable situation to actually be something that will help us in the long term. Censorship, obfuscation, opaqueness never really works. It doesn't work in your family, it doesn't work with your closest relationships, it doesn't work in a leadership position for the country, and it doesn't foster trust and safety. In fact, it fosters the very opposite, and we can see that all around. So that's the reason for this video. Thanks for watching.